first, we have an exciting new partnership we want to tell you about involving our weekly Wellness Wednesday segment. North Mississippi Health Services is now our official Wellness Wednesday sponsor. We're looking forward to working with them to give you news and information on how to live and be healthy. And as you know, October is Breast Cancer Awareness Month, and that's our focus today. And joining me right now is Dr. Tanya Sanders, who is a surgeon and director of the breast program at North Mississippi Medical Center. Thank you so much, Dr. Sanders, for joining us. You have been in this profession for so many years. What are some of the changes and advances that you have noticed when it comes to breast care?
Well, first, thanks for having me, Tanya. So what we do now is something that we call oncoplastics. So it's kind of a marriage between cancer, breast surgery, and plastic surgery. So traditionally, we would just take out the lesion, try to save the breast, and oftentimes patients will be left with a pretty significant deformity. So if we use plastic surgery techniques to recreate that breast mound, also hiding the scar, either circumrellar, under the breast, out to the side, we can give them a much better cosmetic result, and they're much happier patients.
Wow, and when it comes to you learning all these techniques, of course you had to travel. How does it feel knowing that you are helping patients to become whole again, so to speak?
It's fantastic. I mean, studies show that patients' psychological well-being, sexual well-being is oftentimes related to what they see in the mirror. So by going to these places and learning hidden scar techniques, reconstructive techniques, my patients are much happier than they were from the surgeries we did in the old days, if you want to call it that, where they were oftentimes left kind of disfigured. So. And
when it comes to October being Breast Cancer Awareness Month, what message do you want to send to any woman out there who may not know, should I go get myself tested?
So certainly you want to get mammograms starting at age 40. If you have a first-degree relative like your mom with breast cancer, you want to start 10 years prior to their diagnosis, or age 40, whichever comes first. But screening is paramount. We're finding younger and younger patients with breast cancer because our screening techniques are better and we have more screening opportunities for patients. So the main thing is get screening.
Okay, and of course, as you know, the FDA just came out with a new approval when it comes to breast cancer care, and that has to do with breast density.
Yeah, so the breast density is classified from A to D, D being the most dense. So with breast density, mammography, traditional mammography, can be very difficult to see what's behind all that density. So 3D mammography has helped with that. MRI helps with that. We have something now called ABUS, which is an automated 3D ultrasound. So when we report density on mammography reports, now the patient has that information to say, hey, my breast is dense. I need maybe these additional techniques to have a better look in the breast and make sure that we're not missing anything. So.
And when it comes to patients, are you seeing, you said you're seeing younger and younger women coming to North Mississippi?
Yeah, I mean, almost every week it's a 30, a 40-year-old patient, maybe it's their first mammogram and they find something. So self-breast exams, know your family history, know if you need genetic testing. We have those services available as well, but screening is paramount.
All right, thank you so much there, Dr. Tanya Sanders, for joining us.